All right, diving right in today, we're tackling something that's, well, frankly, a bit unnerving, those infections you can pick up in the hospital. It's something you don't really think about until, oh, well, sometimes it's too late.
Yeah, you're right there. It really can be a hidden danger.
Right.
And we're fortunate to have a lot of solid research to draw on today. The CDC, WHO, even Mayo Clinic weighs in on this.
That's right. We've also got insights from the Joint Commission, NIAID, and the American Hospital Association, so we're really looking at this from all angles. And, the goal today isn't just to skim the surface, we're going deep. How do these infections actually happen? Who's most at risk? And, probably the most important part, how can we stop them?
Exactly. And we really want to make sure you walk away feeling like you can make a difference for yourself, your family, anyone you know.
So first things first, what exactly are we talking about here? What makes an infection a healthcare-associated infection?
Well, Mayo Clinic puts it pretty clearly. These are infections that pop up while you're already getting medical care, whether it's surgery or any other kind of treatment. The key is you didn't come in with it.
Got it. So it's something you pick up during your stay.
Exactly. And it's important to remember, this isn't just about hospitals, even though we often use that term. We're talking about any healthcare setting, outpatient surgery centers, dialysis places, nursing homes, even home healthcare. It's a much bigger picture.
Wow. Okay, so it's a pretty widespread issue then. What are some of the common infections that you see popping up in your research?
Well, the CDC, they break it down into a few main types. You've got surgical site infections, pretty self-explanatory, right? That's where you had the surgery. And then there's those bloodstream infections that can happen from central lines, which are a certain kind of catheter.
Mm-hmm.
Those can be pretty serious.
Right, and then there's those urinary tract infections, also from catheters. And for folks on ventilators, there's the risk of pneumonia.
Yep. And two others you hear about a lot, C. diff, that one can cause really nasty diarrhea, and then there's MRSA. That one's tough because it's resistant to a bunch of antibiotics, so it's harder to treat. NIAA really stresses that one.
So these are some serious bugs we're talking about here. What is it about hospitals that makes them, I guess, breeding grounds for this kind of stuff?
Well, there are a few things going on. First, you've got a lot of people in one place who are already vulnerable, right? Their immune systems might be weak because they're sick or older, or maybe they're on chemo, something like that. They're just more susceptible.
Yeah, that makes sense. Their bodies are already fighting something.
Exactly. And then on top of that, you've got all these procedures and devices, IVs, catheters, those ventilators. These are necessary, of course, but they also create ways for bacteria and other things to get in. It's a delicate balance, really.
So you're kind of trading one risk for another, in a way.
In a way, yeah. And then there's the whole issue of antibiotics. Hospitals use a lot of them, which is important for treating bacterial infections, but it can also lead to resistance over time. Those superbugs we talked about.
And of course, there's the human element. Even with all the protocols, sometimes hand hygiene isn't as consistent as it needs to be.
Right. That's a big one. Hand washing is like the first line of defense.
Yeah.
But getting everyone to do it perfectly every time, it's tough. And then you've got the environment itself, surfaces, equipment, even the curtains can harbor those nasty bugs if they're not cleaned properly.
So it's like a whole bunch of factors coming together. But what really struck me in the research is how many of these infections could actually be prevented?
Right. The Joint Commission really hammered that home. They're saying a good chunk of these infections, maybe even up to 70%, could be avoided if everyone followed the guidelines. It's not just an unavoidable part of going to the hospital.
That's huge. It really makes you think about how important it is to be informed about this stuff. So let's shift gears a bit. How big of a problem are we talking about here globally?
The WHO says it's hundreds of millions of patients every year worldwide. And in developed countries, it's something like 5 to 10% of hospitalized patients getting at least one infection during their stay.
And I'm guessing it's even worse in developing countries.
Yeah, it is. The WHO says the risk can be 20 times higher in some places. It really highlights the disparities in resources in healthcare systems.
And here in the U.S., what's the picture like?
Well, according to the CDC, about 1 in 31 hospital patients has an active infection on any given day. That's a lot. And it adds up to almost 700,000 infections every year just in acute care hospitals.
That's just mind-boggling. And tragically, those infections lead to tens of thousands of deaths annually.
It's true. The CDC estimates around 72,000 deaths a year in patients who had a healthcare-associated infection. Now, not all of those deaths are directly caused by the infection, but it definitely contributes. especially for patients who are already really sick.
Right. It's another layer of risk on top of everything else they're dealing with. And of course, there's the financial burden, too. These infections must cost a fortune.
Oh, absolutely. Estimates put it somewhere between 28 and $45 billion every year in the U.S. alone. And that's just the direct medical costs, things like longer hospital stays, extra meds, more treatments.
Wow. And that's not even counting the lost productivity and the need for care after they leave the hospital.
Exactly. Those indirect costs are huge. When someone has a long recovery or complications, it affects everyone, the patient, their family, even the economy. But even beyond the numbers, it's crucial to think about the human impact. What does it actually mean for someone to catch an infection while they're trying to get better?
Well, for one, they're stuck in the hospital longer, right? Your research says an extra 7 to 10 days on average. That disrupts everything: work, family life, just their sense of well-being.
Absolutely. And with a longer stay, you're more likely to need even more interventions, more antibiotics, maybe another surgery, maybe even a stint in intensive care. It's a lot to handle, physically and emotionally.
It's got to be so stressful. You're already sick, and now you've got this new thing to worry about. And then there's the financial hit. Even with insurance, it can really add up.
Yeah, those out-of-pocket expenses can be a huge burden. And there's this psychological toll, too. Imagine getting sicker in the place where you're supposed to be getting better. It can really shake your trust in the healthcare system.
Right? And it can make you anxious about going back to the hospital in the future. And then there's the whole antibiotic resistance issue. We talked about it earlier, but it's worth revisiting.
Definitely. When hospitals use a lot of antibiotics, which they have to treat these infections, it can create these superbugs that are resistant to the drugs. And that's a problem for all of us, not just people in the hospital. The CDC says there are millions of antibiotic-resistant infections every year, leading to tens of thousands of deaths. It's a huge public health crisis.
It really brings home the far-reaching consequences of these infections. They don't just impact the individual patient, they affect the whole healthcare system and even our ability to treat infections in the future. So knowing who's most at risk is crucial.
Absolutely. And while anyone can get an infection, certain folks are definitely more vulnerable. Age is a big one, babies and the elderly, because their immune systems aren't as strong.
And people with compromised immune systems, like those with HIV, cancer patients, transplant recipients, they're at higher risk too.
Right. And how sick you are in general plays a role. Someone who's already critically ill is going to be more susceptible. And then there's the procedures themselves. Complex surgeries, especially those that take more than 2 hours, the AHA pointed this out, those carry a greater risk of infection. And the skill of the surgical team matters too, of course.
And what are those medical devices we talked about? The catheters, the lines?
Those are big risk factors. They provide a direct route for germs to enter the body. The longer they're in, the higher the risk. And it's the same with your overall hospital stay. The longer you're there, the more exposure you have.
So it's kind of a numbers game in a way.
Yeah, kind of. And then previous antibiotic use can also make you more vulnerable because it can mess with your body's natural defenses. And some areas of the hospital, like ICUs, burn units, and the neonatal units, they tend to have higher infection rates because of the types of patients they see.
Right. But it's important to remember, having these risk factors doesn't guarantee you'll get an infection. And not having them doesn't make you invincible.
Exactly. It's about being aware of the risks and taking precautions. So let's talk about some of the most vulnerable groups. We mentioned ICU patients.
Right, because they're often critically ill and have lots of devices and are on lots of antibiotics.
Exactly. It's like a perfect storm for infections. And surgical patients, especially those having big procedures, they're another high-risk group.
And folks with weakened immune systems, of course.
Right. They're more susceptible to a whole range of infections no matter where they are. And something interesting the research brought up is the role of social factors. People from disadvantaged backgrounds, they might be at higher risk because of things like pre-existing conditions or poor nutrition. And there can be regional differences too, depending on access to healthcare and resources.
So understanding these vulnerabilities is key to prevention.
Definitely. It helps healthcare providers focus their efforts where they're needed most. And it empowers patients to advocate for themselves. You know, if you or your loved one falls into one of these high-risk categories, you can be extra vigilant.
Right. Speaking of prevention, let's dig into that. What can be done to actually stop these infections from happening in the first place?
Well, it all starts with hand hygiene. Seriously. The WHO cannot stress this enough. Washing your hands with soap and water or using hand sanitizer, before and after touching patients, before any procedures, after exposure to bodily fluids, after touching anything in the patient's area. They say if everyone did this right, we could cut HAIs by up to 50%.
That's a huge impact from something so simple. What else can healthcare providers do?
PPE is essential, of course. Gloves, gowns, masks, eye protection, using them correctly every time is crucial. And then there's cleaning and disinfecting the rooms, the equipment, everything. Got to be thorough.
And how about those devices, the catheters and lines?
Those need to be managed very carefully. Only use them when absolutely necessary, make sure they're inserted using sterile techniques, and take them out as soon as they're not needed anymore. Like with urinary catheters, taking them out sooner rather than later can really lower the risk of infection.
The research also talks a lot about antibiotic stewardship programs. What are those all about?
It's all about using antibiotics wisely. Choose the right drug, the right dose, and the right duration, and only using them when they're truly needed. This helps prevent those superbugs from developing. The NIAID really emphasizes this.
So it's not just about what individual doctors and nurses do, it's about the whole system working together.
Absolutely. Hospitals need good surveillance systems to track infection rates and catch outbreaks early, and staff training is huge. Everyone needs to be up to date on the latest guidelines. And strong policies and protocols from the top down, that's crucial too.
So it sounds like a lot of responsibility falls on the healthcare providers, but what about patients themselves? Is there anything they can do to protect themselves?
Absolutely. Patients should never be afraid to speak up. One simple thing is to ask your healthcare provider if they've washed their hands. It's totally reasonable. And if you see something that doesn't seem right, say something.
That's empowering. What else can patients do?
Understand your treatment plan. Know why you're getting certain devices and how long you'll have them. Ask questions. And practice good hygiene yourself. Wash your hands often, especially before you eat and after using the bathroom.
And if you notice any signs of infection, definitely report those right away.
Right. Fever, pain, redness, any unusual discharge, changes in your urine, anything like that, tell your doctor or nurse right away. And visitors, they play a role too. Wash your hands when you come and go, don't visit if you're sick, and follow any isolation precautions.
So it's a team effort, really, but it's encouraging to know that prevention efforts can actually work. The research mentions some success stories.
Oh yeah, there's been some great progress. The Joint Commission talks about the drop in bloodstream infections from central lines. Many hospitals have cut those rates by 50% or more. And it's because they're using these standardized prevention bundles. It's like a checklist of best practices so nothing gets missed.
It shows how much of a difference consistent effort can make.
For sure. And surgical site infections, those rates are down too, thanks to things like giving antibiotics before surgery, careful skin prep, and keeping the patient's temperature stable during the procedure. It proves that prevention works.
So there's been progress, but there are still challenges, right?
Unfortunately, yes. One of the biggest is the rise of those multi-drug resistant organisms. They're a real threat because they're so hard to treat. And finding that balance between infection control and other aspects of care, that could be tricky. Like isolating patients to prevent spread is important, but it can also be isolating for the patient, you know.
And some hospitals still struggle with resource limitations, not enough staff, not enough supplies.
Right. And even something as basic as hand hygiene compliance rates are still only around 40–60% in many places. So we've got work to do there.
So looking ahead, what are some of the things that might change the game in terms of infection prevention?
Technology is a big one. We're seeing electronic hand hygiene monitoring systems. Those can give real-time feedback to staff. And UV disinfection robots are becoming more common. They can help clean those hard-to-reach places. And researchers are even working on antimicrobial surfaces that can actually kill bacteria.
That's pretty cool. And what about the use of data?
That's another exciting area. They're using big data and AI to predict who's at risk of infection and maybe even detect outbreaks before they happen. And of course, there's research into new treatments like new antibiotics and even phage therapy. That's where they use viruses to kill bacteria.
And antimicrobial stewardship, that seems to be gaining more traction too.
Yeah, that's about using antibiotics appropriately to avoid resistance. The AHA is really pushing for this. So we're starting to see a more holistic approach to infection prevention. It's not just about individual actions, it's about the whole system. Everything from how the facility is designed to the overall culture of the organization.
Right. So it's going to take a multi-pronged approach to really make a dent in this problem.
Exactly. But despite the challenges, there's reason to be hopeful. We've got dedicated healthcare professionals, new technologies, and a growing awareness of the issue. We can make a difference.
This has been a really eye-opening deep dive. We've covered a lot of ground, what these infections are, the huge impact they have, who's most at risk, and the power of prevention.
And hopefully you're walking away feeling more empowered. You know what to watch out for and what questions to ask. Never hesitate to speak up about infection prevention for yourself or your loved ones. It's your right.
And to all the healthcare workers out there, thank you for all you do. Your dedication to infection prevention is truly life-saving.
So here's something to ponder. What truly innovative solutions, maybe something we haven't even thought of yet, could help us eliminate this problem once and for all? And what role can we all play in making that happen?